I talked to one of your patients a while back on the podcast, and you helped her make her arms much slimmer. And I want to think that she might have had big weight loss and her incision extended back to the back. Do you sometimes do that? And what do you call that?
I think what you're describing is a brachioplasty, which is basically removing extra skin from the arm in addition to the fat. So yeah, that's kind of takes the conversation back to any given patient and what's the problem with the extra folds that they have in the back. Massive weight loss patients typically run into a slightly different problem. It's not just the fat that is the problem. They a lot of times they've actually lost the fat. It's the extra skin that has grown in response to the fat that they used to have. And now when the fat goes away, that skin does not necessarily shrink back to the same extent. And now we just have extra skin that is sort of folding over. And to some extent, the extra skin is always a little bit, the challenge and the determining factor of like what we can do and how we can help the patient and what incisions we have to place. For someone who hasn't gained a lot of weight and they just have a little bit of volume, we can liposuction that out and the skin will shrink back. For some patients who gained a little bit more, we have to use some skin tightening techniques in order to try to compensate for that initial weight gain. So Renuvion is my go-to for that. Typically after liposuction, I would tighten up the back skin with Renuvion, which is basically kind of heats up the collagen from the inside and really tightens up the entire patch of skin in the back and really allows the skin to redrape more favorably and mask that fold that we were talking about. And the fold pretty much disappears if you have good patient selection. If unfortunately somebody was 250 or 300 pounds at one point in their lives, and then they have massive weight loss, with bariatric surgery or with Ozempic nowadays, and they go down to like 250 to like 130, 140, that's a patient that will not have a lot of fat on them, but they will have a lot of extra skin that will not respond to skin tightening like Renuvion. At that point, that patient needs to have that skin just resected or surgically removed. And so we basically trade that for a scar. And that goes back to your question. Where do those scars go? It really depends on where the skin is. There's lots of ways to do it. The classic technique for the back would be a thoracoplasty, which is basically an incision right across the bra line. That's sort of the classic way of doing that. I have a way that I prefer a little bit more that masks that incision a little bit better, which is called like a crescent thoracoplasty on both sides. So instead of having an incision across the entire back, I put the incision between the arm and the front of the breast, and it's kind of a curve. So it hides in the upper side of your chest, sort of under the arm, and it allows all that back skin to be pulled up and then removed. So we avoid a horizontal incision across the back. And it's a little bit more masked. It's a little bit more work because you have to flip the patient twice in order to do that surgery, but I think it's a nicer result.
That's really interesting. I love that idea of how you pull it from a different spot. And then, because, it's like you want to look great, but you also have to function and move. And you think about how much our bodies move and stretch and bend. And that's part of your calculation too, is like,
correct.
How are we going to get you to the goal of removing that excess skin, but also raise your arm above your head or something?
Scar placement is always a little bit of a challenge. I mean, I like it to keep it like as simple as possible. Ultimately, whenever you have a patient who is a massive weight loss patient, they just have skin that they end up trading for seams, as in scars. But if you have enough skin removal procedures, then they have seams. And then, some patients stage this. So they have a seam here and then a seam there and then another seam that doesn't really fit. Basically, the crescent thoracoplasty is kind of appealing in the sense that it is one continuous incision. And it's pretty interesting. I have a couple of patients that have undergone this and they love the result, but the incision is very long if you think about it, actually, because these are patients who had massive weight loss. So we ended up doing a breast lift. So they have an incision that starts at the center of the breast that goes all the way out here. Then we continued that into that crescent thoracoplasty, like I mentioned. So that incision then continues to the bottom of the arm. And then they had a brachioplasty, which is the arm surgery as well. So that incision continues on the bottom of the arm and sometimes through the elbow and over here. So I have one long incision from here going all the way down to here and then under the breast. But it is still like a clean look because it's one incision. It's one continuous thing, but it allows to address the breast, the entire back, and the entire arm in one swoop. That's kind of like the most elegant way to take care of a lot of these areas all at once.